I've gotten the signal that we are live. Wonderful. Welcome. Thank you, everybody who's joining us tonight for Ask an Expert. Whether you're joining us live or watching the recording, we are happy you're here. My name is Amanda Rablewski. I'm a licensed clinical social worker with Boulder Community Health, and I coordinate something called the Pillar Program. Pillar exists to get folks connected to treatment and support for the management of substance use disorders all along the continuum of care. So whether that be the highest level of residential inpatient treatment down to non-clinical, peer-led community support, we are here to help you navigate every step of the way. You, a loved one, somebody in your life that just may be needing a little more help to make some different choices. So that being said, we are here tonight to talk about a lot of the things that relate to use and use disorders, and organically that just kind of comes along with trauma, mental health. When we talk about the things that encompass addiction and use disorders, none of it exists in a vacuum and none of them are easy answers. But the hope tonight with Ask an Expert is that this can be a stepping stone into a potentially different, healthier lifestyle and some different lifestyle choices. So again, thank you for joining us for our community education lecture series. I will be the disembodied voice facilitating tonight's lecture. I'm going to be sitting over this way, so you might see our speaker kind of look towards me every so often throughout tonight's discussion. But we encourage audience feedback and participation, so please, if and when you have any questions, go ahead. Put them in the chat box that's on your screen, and we will answer them and address them as we can. Sometimes it's just kind of organically comes up. It's an organic part of the conversation, and sometimes they wait till the very end. So at any point, again, feel free to put those in the chat, and we will address them as time allows. So with that, I am going to turn it over to our speaker tonight, Miss Carol Hiesterman, who is going to talk a little bit about herself and her background and then teach us about energy healing. So stick with us. We'll be right back.
I'm Carol Hiesterman. I'm a registered nurse. I also have a master's degree from CU School of Nursing. And I'm also a Reiki Master, and I work for Boulder Community Hospital, and I see patients both at the Center for Integrative Care, people who have cancer, and I see patients at the Center for Mind-Body Medicine. Uh-oh. And I have, oh, there we go.
Perfect.
Took a while to get the slide to work. Mostly took a while to get my finger to work. So what is energy healing? It's been around forever. And it comes with different names. The one that I do the most is called Reiki, which was developed in Japan. I also do healing touch and therapeutic touch. And it's designed to reduce stress, pain, anxiety, depression, manage treating this side effects of things, improve quality of life. A lot of times patients will just say, I just feel so much lighter when we're done with the session. It comes from Japan. It was developed there, and Rei means higher knowledge, spiritual consciousness. Ki means life energy. It's the same as Chi, which we're a little more familiar with because that's what acupuncture moves. And prana in Sanskrit, Ti or Ki in Hawaiian. Doesn't matter what little name you want to give to it. It's an energy force that we really can't measure very well yet, but what we can measure are the results of having the energy put on somebody. It's a non-physical energy. It animates everything that's alive, and it leaves when we die. Practitioners of this, after they reached a certain level, we can do distance healing, so we don't even have to be in the same room. I've done work with patients when they were getting x-rays with lead aprons on and back in a corner, and it still works.
How do you do that from a different room?
So Reiki, like a lot of different things, has got some symbols that we use just to get our brains into a space where we can actually get out of our own way. What we're doing is I'm not giving you my energy when I'm doing a treatment. What I'm doing is sort of like an oxygen concentrator. I'm just concentrating that life force and then allowing it to flow through me and to flow through you. So I don't have to be touching you. I don't have to be in the same continent as you. That intent has to be there, and you set it, and you can help the person that way. I do some work with animals too, and gave one of my friends a Reiki treatment on her horse, a couple of Reiki treatments on her horse for Christmas present. And so one of them I was going to do distance, and I did it at 7 o'clock in the evening because by then the horse has been fed, there's nothing going on, they can just relax. I didn't know that she'd scheduled a lesson at 7 o'clock.
Oh.
And so I'm working with this horse, and it's, I'm feeling things and he's feeling things. And she said later on, she said, I had the hardest time getting him to connect with me. He just was so distracted. I'm going, well, that's because I was doing his Reiki session.
Right, makes sense.
Yeah.
Okay.
Because this is a non-physical energy, this fits more with quantum science than Newtonian physics stuff. So you don't have to be in the same place. You don't even have to be at the same time. Everything is based on intent. So there's
Okay. Looks like we're back.
yay.
Okay. So I'm so sorry, Carol. Could you repeat that part about just kind of helping people get a different perspective, set that different intention? I apologize.
Right. And also, it helps them feel differently. For a lot
Okay, we're just doing a little troubleshooting. I'm talking to our folks behind the scenes who are doing a great job. Okay. Okay. You're back.
And I'm back.
Yeah. Okay, so and I'm so sorry, I have to repeat it again. But you had a really good point about like the just how we don't know that we're floating through time and space sometimes,
Right.
and like kind of being able to channel that to manage. What did you say about the curveballs or the arrows that life throws us?
As we live in the best of circumstances, we would have this lovely free energy flowing through us all the time, this life force energy. But the slings and arrows of life have a tendency to interfere with that flow. Things that happen to you physically happen to you emotionally and mentally and spiritually,
Yeah.
and that interferes with the flow. We actually have pumps that help keep that flow going. They're called chakras or wheels of light. And their ability to move this through is going to be less than optimal
Mm-hmm.
because there are physical things going on, or there are emotional things going on, or there are mental things going on, especially in the group of people who are having addiction problems or user problems.
Mm-hmm.
Those things are going to change how your brain functions
Yeah.
physically,
Absolutely.
and that it's almost like scar tissue that won't let the energy flow through. So you don't feel how you used to feel. You don't know how a quote unquote normal person feels. I had one client one time that I worked on, and she told her doctor later, she said, I didn't realize I could feel like this. I drove home and I thought, this is how other people feel?
Mm-hmm.
So that's a big deal. You can't strive for something that's difficult to get to if you don't have any idea what it's going to be like when you get there.
Sure.
Why would I try to do something if I don't know if it's going to make me feel better, look better, whatever, live longer, whatever else I want to do? So, anyway, that's our little lovely energy ocean that we're floating around in, and what we want to do with energy healing, like Reiki or some of the other things, is to just set it up so that that flow can get reestablished, that balance can get reestablished. And that's why it's not to work all by itself, but it's great working in tandem with the other things that we can offer people.
Mm-hmm.
So, back to studying it. It's hard to study Reiki on one hand because it's a one-on-one thing.
Mm-hmm.
It's not like I can give 4,000 people a pill and see whether or not it works. This
Right.
is one person interacting with another person, one soul interacting with another soul, which means you can't do large numbers. But there's still some decent investigations and trials that have gone on. One of the things people like to do sometimes is to investigate the effect of Reiki on plants and animals, and it does affect plants and it does affect animals because they don't come into it with a preconceived idea. They don't go into this is going to work, this is not going to work. I have this belief system or that belief system. But you still get down to the problem of it being individual people, and so you can't do big numbers.
Mm-hmm.
So, Reiki versus massage. Okay. Reiki practitioner, some practitioners will not touch, some will. There are rules and laws that govern some of what we do. You don't get licensed, so the state does not control Reiki, which becomes a real problem sometimes with getting it into places like hospitals. I can do it because I'm an RN.
Mm-hmm.
But for someone who isn't, it can make it very difficult for them to be able to utilize this. So,
Would you like to see it moved more towards like regulation, like massage therapists? Do you think that would open up more access?
Yeah, but of course, then eventually it would get into the insurance stuff.
Mm-hmm.
England, Great Britain has a system set up for energy healing, but you have to, whether you're doing Reiki or healing touch or something else, you go through a 2-year program. Then you get a certification, and then you get a license, and they can keep track of it, and then it becomes part of their socialized medicine.
Mm-hmm.
So here it's really difficult because we have so many different modes and modalities, and anybody can do energy healing. It's the intent. Like I said, what I'm doing is I'm not giving you my energy. I'm coalescing and condensing this stuff, and my intent is to let it flow through me and into you in such a way that you can use it to your greatest advantage.
Mm-hmm.
So the person who controls the flow and what happens is actually the patient, not the therapist. The therapist works really hard to keep himself or herself out of the way and to accent that flow and go where intuition tells them to go to help make it go a little better. But back to touch, Reiki practitioners touch very lightly. If they are legally allowed to touch, they also sometimes work off the body.
Mm-hmm.
And if I've got a patient that's got like a sunburn or a radiation area that's really sore, I won't touch that. I work off of it and just brush it until it starts to feel better. It's kind of fun because you can watch the red go away. Massage people, they manipulate the muscles of the client, and they have an extensive training of either 6 months to 2 years, and then they become licensed and accredited through the board. Our training is less vigorous, and that's another one of the problems, is that you can sometimes go to a Reiki weekend and come out with a master's and tell people that you're a Reiki master. I happen to be a slow learner, so there are 3 levels, and I did the first level and then worked with it for a year, and then did the second level, worked with it for a year, and did the third level and then the master's level, and continued working with it. And I've been doing this for about 15 years now. But we're not going to be licensed by state boards because there's just too many different types of things, which is kind of too bad. So typical session, well, my typical session, because what I do is a little bit different than a lot of people. I work with people who have real mental, emotional, and physical problems. And it's not like somebody that would like to get a massage, which is great, or would like to get a Reiki session, which is great just to help you feel better. I'm starting out with people who, for one thing, a lot of Reiki sessions are done front and back, and most of my patients can't lay on their stomachs for various reasons. So I tend to do everything with them laying on their back. What I'll start with is just kind of reviewing their symptoms and what's going on with them. What do they hope to accomplish? What their goals are. The client remains clothed. Mm-hmm. Take off your shoes and empty pockets of anything that's going to fall out when you're laying down. Those are the 2 big requirements. Just get comfortable. If you've got a tight belt, loosen the belt. We can use music or imagery. I use both, depending on what's going on. I use music all the time, and I'm very careful about the music that I use. Imagery will depend on what's going on with the client, but I have several different types of imagery I can use to help them get relaxed a little bit, because sometimes people will come in so tense and so upset that just sitting is difficult. Mm-hmm. So if you get them to sit, we'll do some breathing exercises, because the brain's going blah, 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 blah. And if you try to tell your brain to shut up, it just talks harder and louder. So what we'll do is give it a different job. So your job right now is going to be to focus on different parts of your breath, and I can lead them through the breathing exercises, let them sit with their feet on the floor and do some grounding, and then they can lay down. It makes it much easier for them to be able to go through the rest of it. And sometimes we'll do other mindfulness things like wandering through the 5 senses or a body scan, just depending on what the patient needs. sometimes they will just lay down and go out. And they don't want to hear me talk anymore. So I'm also then going to assess the client's energy systems. Well, how do you do that? You start with just moving your hands lightly off the body just to get an overall feel for how that external energy flow is going. And sometimes people will be so drained because this has been going on for so long that I have to actually physically hold my hands off their body because they want to suck it in. Then I also look at those energy pumps we talked about earlier, the chakras, starting with the root, which is by your seat bones, sacral, solar plexus, heart, throat, brow, or third eye, and crown. And I happen to use a pendulum to do it because it's quicker for me. It acts like a stethoscope. It just amplifies things. I can do it just by feel, but I can do it quicker this way. So I'm going to assess this energy system before we start, so I know areas I may have to work on some more. And then as I go through with light touch, I will often start at the feet and then just help them relax some more, and then go up to the head and work my way down with light touch on the body. Hands just sort of sitting there for a while, and I will go back and recheck those chakras as I'm working. Because sometimes you'll get one area that opens up and that will shut another one down. And you have to go back because we're rebalancing everything. And that takes a little bit for your body's energy system to figure out what we're doing. So when we're done, we reassess and retreat as needed. And then often wake them back up. Have them do some couple deep breaths and wiggling around and gently sit up, because during this, a lot of times blood pressures drop very nicely, pulse rates drop. You don't want to try to get up and run off because you'll fall on your nose. So wake them slowly up, let them get up gently, and then they can go about their day.
You mentioned that you're really thoughtful about the music you use. What kind of music do you use? Does it depend on the person? Does it depend on the day, the setting?
A little of all of that. I have some meditative CDs that I sometimes use, but that will depend on the person. I've got 2 or 3 different CDs that are my favorites right now. I have one that I use a lot, again, depending on the person, that is a combination of Navajo flute and Gregorian chants. I know. It's called Finding
cool.
Serenity, and
Yeah.
it's really cool.
Yeah.
So I like to listen to that one a lot. I also have crystal bowls.
Okay.
So it's mostly going to be New Age stuff or relaxation stuff. Or I have this one guy that I really like his CDs. So I've got some Winter Solstice is one of his CDs that I use. It's the same thing. It's mostly flute.
Okay.
And it just kind of depends on where I am, because this is an interaction between me and the client, and what I think the client might specifically need. And occasionally, I've got people I've worked with long enough, they'll have their favorites,
Sure.
and I'll just swap them out for that.
Well, and you also use, because I could smell it today, this wonderful
Yes.
lemongrass. So you use aromatherapy as well.
I
is that
use
right?
aromatherapy. Yes, I got trained in that when we were doing the Urban Zen. And I use, and actually I use the pendulum again to douse which scent we're going to use, or occasionally a combination of scents. And I have frankincense and myrrh, peppermint, Siberian fir, lavender, and lemon. And you think lavender, because it's so relaxing, that I would use that the most, and I actually use it the least, because people often need support more than they need relaxation. You can't relax unless you feel supported.
Yeah.
And that's what some of the meditation stuff does, is just helps you feel like the bed is supporting you and this is a safe place to be, so that you can relax and let the work go on. Things it does, it's been shown to decrease anxiety, tension, body stress response. There's some people doing some new research now looking into its effect on the vagus nerve, the vagal nerve. Because a lot of what we see as a result seems to correlate with normalizing that nerve. because it has a lot to do with sympathetic and parasympathetic and arousal symptoms.
Yeah, that kind of seems like the super highway to
Yeah.
your nervous system and really what your whole body is telling you.
Yeah.
Right.
And we all talk about, neurons that fire together, wire together. The more you do hyperactive and catastrophic thinking, the more you're going to wire that way. The more you can do a relaxation and accepting and outgoing thinking, the more you're going to rewire that way. And what you really want to do is do all of that stuff like the mindfulness things when you don't need it, because then you can have it available to you when you do need it. When you're in the middle of a crisis, it's not the time to try to learn how to deep breathe. It doesn't work really well.
Yeah.
It's
Not
like
a
it's
great
like
intervention at that moment.
like never tell a woman to calm down.
Right.
It's not going to work. It does help reduce pain. I've actually had a few instances, because I've been doing this for so long and I work in the inpatient unit sometimes too, where people have come back from surgery and their pain isn't under control, and just a few minutes of off the body Reiki and the pain goes away and gets back under control, and then we can start using our traditional ways of medications. So you just sometimes have to get things ready for what we do to make them better to work.
Yeah.
And it's just it's kind of fun and amazing to watch the patients who are going, how come it doesn't hurt anymore? It does help facilitate wound healing. It really seems to work a lot with the whole inflammatory system, which is how we move fluids around in our bodies. And you can sometimes, if you've got an area that's really swollen, you can actually see the swelling start to go down a little bit while you're working on it. And mostly it just helps you reset. You get a chance to find out how else you can live and function in this world.
Well, that's why we love it so much for people in their recovery, especially in their early recovery, because, all systems are in hyperdrive and have been for a really long time for people that have been active in their use. And I want to, and actually, yep, that's your next slide. But I want to mention too, and I'll give you a chance to go through this one, but what you said before about grounding and just getting people like safe and grounded in the space before you start the session, that word will always resonate with me, and I think a lot of mental health practitioners, because it's a really big thing we do for trauma work, is because when people are getting overwhelmed, they can ground, right? What do you feel? What do you see? What can you hear? What do you taste? And
focus on the soles of your feet.
Exactly. And getting back in touch with your body in a safe way is such a valuable gift. It's such an important thing for people in any circumstance, but certainly people who have like trauma histories, sexual assault histories, some of the things that kind of just would potentially go hand in hand with being active in a substance use disorder.
When people are going through this, they don't know how to feel another way.
Right.
The trauma has been so hard and usually so young. You don't have a chance to develop coping skills. You don't know that there's another way to be. And eventually what we're hoping to do with therapy and a lot of the other tools that we have to use is allow that highway that is the more relaxed one to increase the neuroconductivity so that you can start to slowly come around. But when we're first starting out, that's not where we are.
No.
We're starting out with people who being able to put one foot in front of another one and drive to their appointment is a big, hairy deal. And that's why a lot of times, instead of just starting out with, okay, I'm going to do Reiki on you right now,
Right.
we'll start with, just talk to me a little bit about what's been going on and establishing that rapport, because that's part of the whole Reiki session. It's verbal rapport, but it's more than that. It's emotional rapport and soul-to-soul rapport, and you have to realize that I'm okay to be with you and that this is a safe place for you to be, for someone who's never known a safe place. And then we'll start, that's where sometimes we'll start maybe with breathing.
Yeah.
And I will watch them breathe. They won't even realize that they breathe like this with their shoulders up next to their ears all the time and very shallow. And you can work with them one-on-one slowly to get them to actually take a deep breath. And you just watch their physical body go, whoa, what was that? I'm going to breathe in what I need and out what I don't need, in what I need and out what I don't need, just to get things started. Because what we're looking at all the time is how do we improve balance?
Right.
How do we get things to the point where it feels okay to be alive and be human?
Well, and right, I mean, that's the universe, right? Trying to constantly be balanced, but then our bodies too, right? They're always fighting to find that homeostasis.
Yep. And if they don't know what it feels like, how do you know how to get there?
How do you get there? Yeah.
So, what does this slide say? Okay, alternative treatments like Reiki for addiction have been shown to be effective in some cases. And again, we go back to the whole problem with trying to do a lot of clinical trials when you're dealing with something that requires a one-on-one. Mostly it's expensive, and you can't get the big numbers. But what you can do or listen to are the anecdotal things where people will say, this is what I see. This is what people tell me. This is how I feel. And it's not good scientific method, but what it keeps showing is there's something going on here. It may not be the way I think it is or for the reasons I think it is, but there is something going on here. And when you're going through withdrawal, when you are going through trying to change your life to a life that you really have no idea what it could be like, anything that can help ease that a little bit is a good way to go. And the channels that bring that healing energy into your body, we want to balance them and harmonize them. It's not like I'm going to work on just one. That's why I go back and recheck and recheck and recheck, because what I want is the root to talk to the sacral, to talk to the solar plexus, to talk to the heart, the throat, the third eye, and the crown, so that everybody is on the same page, nobody's taking over, and allowing everybody just to flow together to give you that best possible place to be in for that time. It actually, a lot of times, it really can alleviate complex emotions, and especially when you combine it with some of the mindfulness stuff. That's what's so nice with the therapists and the Reiki people and acupuncture. All of those things working together are coming from different directions to help you do the same thing.
Yeah, the treatment team really does work in tandem at BCH, our treatment team that does all of those things, because like we've talked about, like I mentioned previously, none of it exists in a vacuum.
No.
So no one thing is going to be just
You
the
didn't
thing.
just have an absolutely fantastic life going on and you tried a drug and now you're addicted.
Right.
That's
Yeah.
not how
Not
it
how
works.
this works.
Yeah, you have, for a lot of people, their problems, especially with addiction stuff, start really, really young. You don't have the coping skills that someone else maybe has because you didn't have the opportunity to develop them. And physiologically, our brains change dramatically as we're aging, and whether or not we are exposed to love and safety
Yep.
and normal, but nice, quiet, healthy, loving, one with everything environments are not what usually you find people who have addiction problems were allowed to see. That wasn't their lives. That's back to this, nothing happens in a vacuum.
Yep. Well, and trauma too, right? Changes the
Yes.
structure of your brain.
Well, and one of the things that we look at with chronic pain is one of the things the Boulder back study showed was that you can have really lousy looking MRIs of your back and compare that to just about everybody over 70 has got a really bizarre looking back. But some people will have chronic pain and some people won't, even with the same type of injuries. Chronic pain doesn't occur by itself. It occurs usually in the picture of having high anxiety. Because your body is sitting there expecting catastrophe. And then if something happens, you have a car accident, something hurts, your brain's already primed to go, this is going to be absolutely terrible. This is going to be absolutely horrible. This is never going to let me live. Versus someone who goes, yeah, this is pretty crappy right now, but, in 6 months it feels better. Same test results, different ways of having it happen.
Yep.
That's the end of my slides.
Okay. Well, we will give just a few minutes if anybody has any questions or any thoughts you want to drop into the chat. The resource slide will be up in just a second. So my contact info is up there. Shoot me an email if you want to talk more about resources that are available. Let me know if you want these slides. I'm happy to share them. But I also put the contact info for the Center for Mind Body Medicine, so you can schedule with Carol and have one of these wonderful Reiki treatments and address whatever may be going on. In the meantime, while we give folks a second, what got you interested in this? How did you go from nursing to Reiki Master?
Energy, that type of connection, I've always had since I was a kid. Started out with animals, somebody come by and where's Carol? Well, she's out in the barn with the sick cow. Just because there was a calling to be there. I didn't know what I was doing. And the first 8 years after I got my RN, I worked in Pediatrics. And we had a newborn nursery, and I discovered that we didn't have all of the fancy things now. O2 sat and things hadn't been invented yet. You ran just on the seat of your pants and paying attention to what was going on. And sometimes preemies would just kind of get tired and forget to breathe. And you'd give them a little IM injection of caffeine, and it would eventually work. But in between times, if you just sort of hovered over the bassinet and sent thoughts about, come on, breathe in and breathe out, they'd do it. And then the caffeine would work and you could go take care of your other kids. So that kind of thing has always been around, except you couldn't talk about it. This isn't scientific. You're not supposed to do that. That's why it's interesting to have a Master of Science from the School of Nursing, and I'm a Reiki Master. It's like,
Kind of in direct opposition of each other.
and yet they aren't, because
And yet
we
they
can't.
aren't, exactly.
If we can't measure something really well, we can measure the effects of it. So I have pretty much always used this. And then once I decided that I was 65 and a half and I could not deal with 12-hour shifts anymore, I retired from floor nursing and started working at the Center for Integrative Care doing therapeutic touch. And then as I got more into this and started getting into more and more complex patients, discovered I really needed more help. And then started taking classes and studying. And I've always studied this sort of thing. You just, you read a lot.
Yeah, and then it crept in, right?
And it crept in, and pretty soon I'm going, well, maybe I'll retire.
Can you talk a little bit about the experiences you have working with the folks on our inpatient behavioral health unit and the real-time changes you've seen with folks that maybe not quite active in their psychosis, but are, they're admitted for being psychotic or suicidal and these really, really intense diagnoses.
Things are not going well for them, or they wouldn't be there.
Exactly. They're trying to get stable.
So they get a free 15-minute session in a massage chair. So I'm only going to be working on their head and back. And the responses I get are very varied. I've had two patients that I've been doing this now for about 6 years who in the middle of it said, I just can't do this, and left.
Okay.
It's okay. Most of the time I've had several where it takes a couple of minutes afterwards to wake them up. And a massage chair, if you've seen it, you're face down in this bizarre looking thing, which actually supports you quite well, but it doesn't look all that comfortable, and you don't think people are going to go to sleep, but they're drooling. I mean, they're so relaxed. I've had some people who will go, that is the most amazing thing I have ever felt. I had one client once who had had ECT, convulsive shock therapy, earlier that day, and often your brain is just so scrambled that you don't know what's going on, and he was just driving everybody nuts because he was in so much pain, and he didn't know where his pain was, and he didn't know what he wanted to do, and they're looking at me like, you want to try him? So we went back, and there's no way he could do the massage chair. I just sat him in a chair, stood behind him, and put my hands on his head for 15 minutes. And after the first 5, he stopped talking. Because before he was just little. And after 10, he stopped twitching. And at the end of the 15, he got up, went back to his room, and said, I think I'll take a nap. Just absolutely the opposite. Saw him again the next week. He didn't remember any of it.
Really?
Yep. But that's not uncommon with the ECT. So sometimes you'll get deep relaxation. Sometimes you'll just get, wow, that's fantastic. Sometimes you'll get, no, it was okay.
Mm-hmm.
It's for whatever that person needs and is ready for.
Yeah. Do you find that, because I know you said that people aren't borrowing energy from you, but building that rapport and getting people into that safe space, do you find that it does drain you?
Mm-hmm.
Yeah.
I get tired at the end of a day. I'm kind of old, so my feet hurt.
Girl, I'm young and my feet hurt.
So
Young-ish.
I wind up standing a lot. You know,
Yeah.
I'll go home going, "Oh, my feet hurt." So it's not. On the one hand, being able to help somebody feel better is just great.
Yeah.
And you're going back with that. But on the other hand, it's like that's why I only work 2 days a week and just a few hours each day, because I'm seeing on an average of 9 to 12 people over a week doing this kind of heavy focusing.
Yeah.
And that's about, at my age, that's about what I can do.
That's a lot. I mean, that's
Yeah.
a lot for anybody at any age, I think. Just kind of walking around in that energy and that emotion tied to
There
it.
is, yeah, and a lot of it is really working at releasing it again, because a lot of people have been through a whole lot of crap.
Yes.
And part of my job to allow you to feel safe enough to get the maximum benefit from this is to help you realize that it's going to be okay and that you can talk to me and I'm not going to be judging you in anything. This is a safe place for you to be. And that gets a little tiring.
Sure.
But I sleep.
Mm-hmm.
I'm fine.
Yep.
I
Self-care.
go play.
We love to preach it. Self-care. Can't pour from an empty cup.
Oh, yeah.
Yeah, we'll take just another minute or two, see if anyone else has any other questions. Drop them into the chat. Let us know. What do you want to know about Reiki and energy healing? About Carol's experiences? And otherwise, yep, just a reminder, the resource slide there. My contact info, how to reach the Center for Mind Body Medicine at BCH. We're here. The recovery community, the holistic care community, medical community. We just want to help get folks to the right places at the right time.
We also offer acupuncture on Monday, Tuesday, and Wednesday.
We do. It is the same number.
Yep. With a really fantastic person who does our
gosh.
acupuncture, Teresa.
Yeah. Both of you are just so wonderful at it.
And sometimes clients will go, well, should I do one or the other? They complement each
Right,
other.
do both.
Just do both. Do what, and then go with what you feel in your gut you need.
Mm-hmm.
And go
Yep.
with it.
Our program, for folks that meet our eligibility requirements, are able to potentially access some scholarships for acupuncture and Reiki through Mind Body Medicine. So check us out, bch.org/pillar, bch.org/pillar. Learn a little more about the programming we offer. There was one other thing I was going to mention, and now I can't remember.
It's like I'm always going, I had this great idea,
Yeah.
and if you can find it,
Right.
would you bring it back?
Did you write it
'Cause
down for me? Let me know.
it wandered off somewhere.
Yeah. Well, it looks like the chat box is pretty quiet. So, with that, I want to thank you so much, Carol. This has been incredibly informative. I had never heard of Reiki before I started at BCH and before I started in Mind Body. It's been a really fascinating journey to work with you and to work with Teresa, our acupuncturist, and to just get the feedback from our participants as well that connect with you all, because it really, especially those, I mean, certainly at any point, but those early recovery days, I mean, it just helps people hold on to sanity. And
Yeah,
then
it is so rough.
yeah, as they get just a little further into their recovery, a little more sobriety under their belt, then using this to really, like you mentioned, like prime the pump to be doing all the other work that goes into being in
Start to
recovery.
rebuild that other part of your nervous system,
Yeah,
which will then ease that hyper part, the catastrophic part.
yeah, absolutely. So yes, thank you, Carol, so much. Thank you to our funders, the City of Boulder, the Health Equity, and the C Funds, for making this all possible. And of course, always a big thank you to Stone Cottage for allowing us to bring this information to the masses and just being so easy and wonderful to work with. We appreciate you guys very much. So yeah, with that, everybody have a fabulous rest of your evening, rest of your day, week, wherever you may be. And we will see you in August when we will welcome Trina Fates, who will be talking to us about craft and facilitating those classes. So we will see you then. Thank you.